I could feel the tumor starting to grow on my neck below my ear.
So I arrived back in 6 months for the checkup mammogram, and that's when I found I had cancer.
Having an operation, no matter how small, is a major life event.
I found that it's a pretty rare tumor and a pretty rare condition.
I wasn't sure I was going to be able to survive the treatment, let alone just knowing that I had cancer.
Many patients come to us when they feel at their worst. We respond by giving them our best.
I was made to feel like it was all about me, so it was very positive.
They were warm and friendly. They were really concerned about how I was feeling. Not just how I was feeling physically, but how I was feeling emotionally.
I'm Jeff Matthews, and this is the University of Chicago style of surgery. It's all about you, helping you understand and helping you heal.
Patients and families are very inquisitive, and that's been my experience here at the University of Chicago. They ask virtually everything about their disease process, the type of operation that would benefit them, the timing of it, the intricate details of each operation.
I was asking questions about her background after I researched her that really, in hindsight, had nothing to do with my condition, but she was more than glad to answer every question and every concern I had.
I actually interviewed 5 different doctors in 5 different facilities. I wanted to make sure not only did I find the right doctor for what I was experiencing and had to have corrected, but that I found the right team and someone who could work with a patient like me who was going to research everything and ask a bazillion questions.
I think patients value honesty above all from physicians, and understanding to the level that they need to know or want to know. And when they get that information or that understanding, I think they are greatly appreciative.
Taking a little time during the initial consultation and throughout their course to educate them, to reassure them, and to allow them time to ask questions is one of our highest priorities.
A well-informed patient that works with the team makes the whole effort a lot easier. Knowing what to expect, knowing why we do certain things, knowing what the pros and cons of a specific treatment plan are, it's really important for them to participate in the care.
Healing begins with understanding, and understanding begins with discovery.
To be a faculty member here is a huge honor, and I think about this virtually every day, where we've had Nobel laureates within our department. The ability to understand and appreciate that history also carries a weight of responsibility to perpetuate that into the future.
We have had some of the masters of GI medicine and surgery working together and making history here at the University of Chicago, and being sort of the third generation of that tradition of surgeons and physician makes me extremely proud.
I would say that one of the most inspiring stories is from Charles Huggins, who was here and made a huge impact on the field of cancer research. And his discoveries that cancers, prostate cancer and some breast cancers are hormonally responsive, that now is a treatment. It's really the mainstay of treatment for prostate cancer and some types of breast cancer.
All around us, every medication that we use, every medical device that we use, somehow got tested, somehow got researched, and somehow got approved for use as a medical device, as a treatment, as a modality.
The ability to take something from the lab that's been proven successful to then bring it over into the bedside of a patient, that leap between the bench to the bedside is obviously what research is meant to be.
So for us, this is a unique environment where, by collaborating with our basic scientists through the translational research, we can really offer state-of-the-art, cutting-edge technology, cutting-edge studies, cutting-edge treatment to our patients.
My fear started to abate on the morning of my first surgery, when they actually were going to remove my breast, which sounds pretty weird, but I had at that point gone through every single question in my mind and had asked them, and they had been answered. I had done as much research as I possibly could. I knew that I had the best doctor and team and anesthesiologist. They all came to introduce themselves to me before the surgery. I had to give it up. I had to finally say, okay, I've done the best I can, and now I have to turn it over to God and the angels and these amazing surgeons and nurses and anesthesiologists who are going to have to see me through to the other side, and they did.
I live 170 miles from this university, and I pretty much come to this university for any health-related item I might have. So I'm more aware of my health, and I'm much more comfortable in this environment than I am anywhere else.
If I had one thing to say to the whole entire team at the University of Chicago, would be thank you for getting up every morning and for doing this hard work. You come in every day with a smile on your face, willing to answer those same questions again, and do them in a way that makes the person who you're talking to feel comfortable and at ease and ready to fight for their life.
This is the University of Chicago style of surgery. It's all about you, helping you understand and helping you heal. If you should need surgical care, we invite you to ask us. Let your healing begin with understanding.